Hey everyone, Dr. Castillo here again with Spanish Chiropractic Success. Welcome back. If you've liked these videos before, be sure to like and subscribe. This is chiropractic content for the Spanish-speaking population. Today we're going to go over x-ray commands. This is an important concept in the clinic, especially for your associate docs. They're going to probably be taking a lot of x-rays, whether it be a car accident, work accident, or sports injury. That's a really common one too. You're going to want to know how to guide people in the x-ray room in Spanish so that they feel comfortable with your clinic. They know that you know your stuff and that you know that you can help them with their injuries. Specifically with x-rays, hopefully you do kind of a similar process that we do. We don't actually have patients take off any clothes. If you do have them take off clothes, I'll make a separate video on that. So I'd have to make different lingo for that. But for our purposes, we have all clothing on for the patient. I usually have them come in and I'll just kind of go through my spiel. I say, ven para acá, por favor. Vas a estar aquí y mirar enfrente. Primero, you're going to come in here and you're going to look in front. And then I'm able to kind of look at them and see if they have any metallic items like a necklace or earrings. So you're going to want to know those vocab words. Aretes. Y, well, I just say like, esta cosa. I don't really know how to say, like, it depends on what they have, you know. But I ask them like, ¿tienes cosas metálicas? Por ejemplo, un cinturón o aretes. And then they tell me like, hey, I actually have my keys, my phone. And I say, hey, puedes poner las cosas allá y puedes regresar aquí. And then they take their stuff off, they come back, they go in front. I tell them, I don't really go through like how I'm gonna position the x-ray. I just tell them like where they have to be and where they need to stand and how they need to position themselves. So really at the beginning, I'm taking all my A to P films. I'm doing my thing right here with the vertical, horizontal. Whether it's on AP, let's say cervical, and I ask them to look down or look up, for example, so that we can see all those oncovertebral joints. I might say, repite por favor, right? Anything you want them to do, just say, repite por favor, because they're going to repeat what you're doing. So if you want them to look up, just say, repite por favor. And then if you want them to not move, just stay still, you just say, no te muevas, right? And then you run over, you do the x-ray, boom, done. If, for example, they're too far forward, you might ask them to go, oh, poquito más atrás, por favor. Atrás is backwards. So they might scoot back, they might scoot back. And then let's say you want them to go left or right. I mean, that's up to you whether you want to say your right or their right. You have to distinguish. So to be honest, if they're like a little bit off to the left, sometimes I might go, hey, puedes mover así? And then I'll scoot a little to the right and then they'll match me. Or if you want to say, puedes mover a tu izquierda? Do you want to move to your left a little bit? Poquitito. Then you can have them position themselves like that. And then after we're done with all the ADP, I'll switch them to the side views. So like lateral views. So if they're like this, I'll say, okay, vamos a chequear el lado así. So vas a tronar así y mirar directamente así. So you're going to say like, hey, you're going to turn. We're going to look here. And then I'll say manos así, right? Depending on if you do this or this to get them out of the view, you kind of have to play that by ear, because some patients are in a lot of discomfort. So before you have that command of hombros así, you might have to wait if they're in pain. If it's just a low back condition and they don't have anything going on in the neck or shoulders, you can be okay. You'll be okay just having them sit like this for a bit. And then you would position everything, make sure, right, they're either forward or backward. So you're going to use those commands of atrás or adelante. Más adelante, por favor, means forward. So if they're too far backward, you have to make them go forward and vice versa. And then if they're not close enough to this bucky right here, you have to say, más cerca, por favor, más cerca. And then shift like this. You can show them how to shift. And this is probably the most important part of the video, guys. For women, I like to tell them what I'm going to do before I do what I do. Specifically when I'm looking for either hip measurements or I want to see like where the hips are, where the belly button is, I'm telling them like, hey, voy a checar el nivel de las caderas, voy a tocar aquí, I'm going to touch right here. And then they say, okay, right? Versus if you just go in there and just start doing stuff, that might be like a little weird. And now that's because I'm a guy. Now if I'm a girl, right, and I'm positioning a girl, it's probably not going to be as weird, but you just have to be understanding of that. And you have to just be aware of that, okay? For guys, I just go straight in there because, I mean, I'm a guy. So that's just me. I feel comfortable. I think play that by ear, but you're never going to be wrong if you say like, oh, okay, voy a tocar aquí, voy a checar el nivel de las caderas. Because I like to check hips. I like to check a little bit higher up to see where kind of like the small of the side lumbar is to position the lateral lumbars. And then I move up the bucket or move up the collimator a little bit to get that side view of the lumbar. And then after that, remember the phrase for stand still, do not move is no te muevas, por favor, right? And then they know to not move, right? And then if you do breathing and expiration films, if you want them to say like, if you want them to say like a breathe in, you can say respire y no te muevas, right? Or suéltelo y no te muevas. Suéltelo is let it all out. I don't do those films specifically, but if you in your clinic swear by that sort of technique and that's a part of your process, all the power to you. So hopefully you guys learned how to do anterior and lateral films here in the clinic. These are basic commands for x-rays for Spanish speaking patients. Have an awesome day, and until the next time.